met Velkanker-bewusmakingsdag, wat die 1 September is, op lentedag, gaan die Velkankervereniging van Suid-Afrika landswyd pasiënte gratis ondersoek vir potensiële velkanker. Dis natuurlik by die Velkankervereniging van Suid-Afrika. Die spesialis-dermatoloog Dr. Ugeshnie Naidoo is hier by ons vanmôre en sy kuier spesifiek om meer te gesels oor die tekens van velkanker en ook as daar 'n emosie of twee is waaroor jy worry. Good morning, Dr. Ugeshnie.
Good morning.
It's lovely to have you here. Thank you for being here to tell us a bit more about skin cancer, the basics of skin cancer. Is skin cancer really that prevalent in South Africa?
So skin cancer is one of the most common cancers that you would see in medicine. And we have different types of skin cancers. What happens is that you have an abnormal growth of cells that have changed on the skin. So we have non-melanoma skin cancers, which are basal and squamous. Basal cell cancer is the most common type that we see often, and it will present as a non-healing ulcer or lesion that is bleeding.
Like a scar or something?
Yes, almost like a scar, and it just does not heal. Or a red lesion that is rough and irritated, that's squamous. But the more worrisome cancer that we worry about is melanoma, melanoma.
Yeah.
Dis 'n musie wat verander.
Yeah.
Yeah. So they can occur de novo, meaning it was never there before. Of dis 'n bestaande musie, wat was altyd daar. So something that was there, and suddenly it changes in a few ways. We remember the ABC rule. It's asymmetrical, the borders are irregular, or the colors of the mole are changing. So if over a 3 to 6 month period, you've noticed
Those changes?
Yes, in a musie, then you would go in to a doctor and have it assessed. Your first line of point of contact could be your house doctor, but of course, a dermatologist has a special device to scan these musies and keep a reference point and monitor them. If necessary, we then do what we call a biopsy. It's a shave off the mole and it's sent to the lab for testing.
It's interesting. It's the most, the cancer that you find most in South Africa. I wasn't aware of that.
So us as South Africans, we get 9 hours of incidental sun during the day.
Wow.
Yes, during the week. So that's a lot of sun exposure. Our incidence in our Caucasian population, which is our white population, is the highest. It's higher than in Australia at the moment because their skin cancer awareness has been in place for 20 years or 30 years. This day we're doing now on the 1st of September, Skin Cancer Awareness Day, they've been doing for years.
For years.
And they would have something on their beaches where people can go in and have a mole assessed.
More proactive.
Yes.
I want to know, so except for a mole, what are some of the signs I need to look out for when we're speaking about skin cancer? Is it like an itchiness? Do I see like a change in color on my skin? Do I just feel bad? What are some of the signs?
So you wouldn't experience any symptoms of the body, such as fever, pain, or itchiness. You'd see something changing and growing on the body. So the color would change. It may not heal. It would change. The actual lesion, which would be looking like a small growth, would be growing and changing in color and maybe texture, so it would feel different. And those are the things. So it's something you would observe. So the important thing is to be aware of your entire skin, not only those areas that are exposed to sunlight.
And does skin cancer only show itself in these like the ABC you said, like these things that grow asymmetrically with borders that aren't set and change color, or is there also something like a rough texture on the skin?
Definitely a rough texture or elevation, changes in diameter. So if you want to add your ABC, the D would be diameter and the E would be elevation. It raises.
Okay.
Yes.
Do we normally see these signs and marks on areas that are exposed to the sun? Or can it be literally anywhere on your body, like on your foot, underneath your foot also, or something like that?
It can be anywhere where we have color cells, which is underneath our feet, on our hands. In dark-skinned patients, it's more often on the palms and the soles. But in anyone, it could be in your hair. So even if you have a musie, when your hairdresser cuts your hair, you should have it checked out.
And every time you brush it, you just irritate it and break it and scratch it off a little more.
Yes, that doesn't increase the risk of it changing to cancer, but if you do have them, you must have them seen to assessed.
Yes, 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 yes.
Except for the assessment, so I see a mole and I go, okay, please have a look at this, and I know, okay, great, that's a way that I can prevent or possibly prevent cancer if I have it checked out enough. Is there anything else we can do? I mean, you refer to the sun and exposure to indirect sun. Is there anything else we can do as South Africans to kind of prevent cancer or skin cancer as far as we can?
So our highest risk factor is our genetics. If you have a family history of melanoma, that's your highest risk factor. We can't change that. But we can change our behavior patterns, such as staying out of excessive sun. 3 severe blistering burns before the age of 18 would significantly increase your risk of skin cancer. Yes, so that's something we can prevent in all our children.
My goodness.
So wearing a hat, staying out of peak sun time, which is 10 o'clock till 2 o'clock, and then wearing your sunblock is your biggest defense. So, you know, and sunblocks, you want to apply them regularly, sufficiently.
So, you know, when you see those people on the beach and they've been lying there for like hours because they want to be nice and brown and tan and whatnot, big mistake, especially in South Africa with our sun.
Yes.
As jou nie, as jy velle afbrand 3 keer voor die ouderdom van 18, is die kans dat jy velkanker kan kry baie hoër. Ek het dit geweet nie. Dr. Ugeshnie, thank you very much. We'll continue this conversation just after the next ad break. En dan gesels ons verder oor Velkanker-bewusmakingsdag, die 1 September. Mense, wie het gedink as jy afdop, is dit gevaarlik? Nou ja, ons praat nou weer. Welkom terug. Met Velkanker-bewusmakingsdag, die 1 September, gaan die Velkankervereniging van Suid-Afrika landswyd pasiënte gratis ondersoek vir potensiële velkanker. Die spesialis-dermatoloog Dr. Ugeshnie Naidoo kuier vanoggend hier by ons om meer oor velkanker te gesels. Dr. Ugeshnie, before the break, you referred to the fact that skin cancer is genetic. I have a grandfather that suffered terribly of skin cancer. Does that mean that I have to be checked regularly?
So melanoma especially is your highest risk factor, is your genetics. So if you have a first-degree relative, and your grandfather would be that, then you would go for a skin check where you would have your mole mapping done. All moles or unusual lesions on the body would be photographed, and that would be a monitoring point. And then once a year on average, or once in 2 years, you would go, we'd look at that photograph and compare it. It's a system where we keep photographic images. And it's a form of pattern analysis. We look at the moles and the lesions, look for changes in their shapes, their patterns, colors, and then if we think there's a problem, then we act on it. And that is what we call diagnostic, making the diagnosis.
Oh, that's interesting. Mole mapping, I've never heard about it. It's fascinating. But so I have to go every year, every 2 years?
Depends on your risk factor. Then there are those cancers which depends on your skin type. A very light skin that doesn't tan easily and burns quickly in the sun would be at a far higher risk of developing the skin cancers which are referred to as non-melanoma skin cancers. So staying out of the sun and protecting your skin is very important if you are lighter, but for everybody. And then using your sunblock. The other thing that you need to be aware of is, so your doctor would tell you then, come back in 6 months, 3 months or a year, depending on what they see.
What the condition is, yes.
So let's say I've been diagnosed with a skin cancer. What is the next step? What treatment's available?
So we have excellent treatments available. First, there is basic treatment done at the practice immediately where we actually freeze it off. That's the most common one which patients would be aware of.
Yes.
But we have newer creams called immune therapies. So it wakes up your immune system against the cancer. And so that's applied to the skin, and your doctor would give you good directions on how to use it and support you during the treatment. It's about a 6-week or 4-week treatment process, and then they would assess you after 3 months to make sure it worked properly. Those are for the more superficial skin cancers. For the more severe ones, they need to be cut out, and we have an excellent center in Pretoria where they cut out and then they use a microscope. So just what needs to be cut out is done. And then plastic surgeon would come in and make sure it's closed well, not in all cases, but where necessary, so that you get the best cosmetic outcome. And then for melanoma, we need a good border to prevent it growing again and spreading, because it can spread to the glands and to other parts of the body. And it's very important. So the first step is to make sure it's cut out properly.
Properly, yeah.
And then we examine your glands, and if necessary, depending how deep it was, we would send you to an oncologist, a cancer specialist, who would look at the rest of the body, do blood tests, check your chest. And then there are excellent treatments in the pipeline and available to our patients, which can give good cures. So previously, prognosis was poor, especially with melanoma. And it's an unpredictable cancer. So the follow-ups are important. Following through with the treatment is important.
Obviously, it's great to hear that there are so many options available, that it's not tickets if you have a form of skin cancer or melanoma. There's a lot of treatment, there's a lot of hope. It's not the end of the planet.
No. So in the last 10 years, we've had these biologics, which are medications that work at a very high molecular level with a lower side effect profile. And I've had patients in my own practice who have been cured from melanoma almost. They still come for their mole mapping, but they lead very healthy, good lives.
What is the survival rate if you've been diagnosed with skin cancer in comparison to some of the other cancers that we have?
So it depends where in the cancer you were diagnosed. If you're diagnosed early, where you've gone for your mole mapping and it's what we call in situ, it's just in the first layers of the skin, your prognosis is excellent. We cut it out and then you just monitor. So I would say almost 90% survival rate to 100%. But once it's spread to the glands, the prognosis, which is the outcome, is a little bit more severe, need to be monitored. And once it's spread into the organs, that's when your prognosis is now not as good.
So catch it while it's still on the outside, before it spreads.
And that's why you want to do preventative monitoring. Be aware. If you see something change, act earlier rather than later. It's going to save you a lot of trouble.
And use sunscreen, the basics. Cover up, use sunscreen, don't stay in the sun for prolonged times, those kind of things.
And the basics of your sunscreen is get a good sunscreen. They don't have to be extremely expensive. It must be broad spectrum, covering, both the UVA and UVB. The newer sunscreens have an antioxidant and even something that protects our DNA, our genes. And that's what changes in skin cancer. Your DNA has changed and it's growing in an abnormal way. So it repairs that. They're called DNA repair enzymes.
Wow.
So a good sunscreen, and it must be applied to the entire exposed area, on average every 2 hours. It sounds impractical, but that's your sort of aim.
Ideally. Oh, we literally have 2 minutes left, but I just want to talk about the Triumph Clinic, where screening will be taking place for free. There's a limited amount of spaces open for people, obviously. Especially in Pretoria, there's a lot of clinics across the country where die Velkankervereniging van Suid-Afrika hulle pasiënte gaan screen verniet, né?
Ja, so hierdie kliniek sien pasiënte deur die hele jaar, maar net op daardie dag doen ons screening.
And it's going to be free of charge for the first people to phone in. Is there a website where the viewers can go to find out where these clinics are in the country?
So you can go to the skincancerfoundation.co.za and you'll see participating doctors. All doctors can screen, all dermatologists. Even if you don't get in on the 1st of September, there are other days that Triumph Clinic has a dermatologist available.
Obviously for a fee, this time not for free.
No, that's for free.
But yeah,
Triumph
also
runs
for free
all the time.
My goodness.
And there are 15 dermatologists that are part of the program.
Wow.
And we see patients regularly. You phone in at the clinic, go onto the website, get the information, and treat all skin cancers, but also all skin conditions for patients who can't afford to attend private health sector.
Wow.
Firstly, it's wonderful to hear what's happening in Triumph Clinic and in other clinics across the country. It's great to hear that the Skin Cancer Foundation is doing this wonderful work and this wonderful screening. And thank you for giving your time, free of charge, on the 1st of September to screen skin cancers. Thank you very much, Doctor.
It's a pleasure.
And thank you for being here. Daar sê Dr. Ugeshnie Naidoo. Wys jou net en onthou, moenie brand in die son nie. Afdop is nie 'n goeie idee nie. Nou ja, afdop is afchop, sê hulle my ore.